Southwest Bariatric Surgeons Group specializes in the surgical treatment of obesity. Our team of highly skilled bariatric surgeons have performed thousands of weight loss procedures and are dedicated to assisting patients realize their health and weight loss goals. We are based in Austin, Texas, and operate in several surgical centers in the Austin and Round Rock area, offering the full spectrum of bariatric surgery including gastric bypass, sleeve gastrectomy, revisional bariatric surgery, gastric banding, and duodenal switch. Successful treatment of obesity, whether it's done through diet and exercise or surgery, decreases the risk of developing obesity-related health problems and improves overall quality of life. Weight loss surgery is proven to be the most effective, long-term weight loss solution. With the right information, the decision to undergo bariatric surgery can be a turning point in your life. Obesity is measured by BMI, or body mass index. BMI is a measurement that compares your height to your weight and gives you an indication of whether your weight is affecting your health. The higher the BMI number, the greater the obesity. As the BMI number goes up, overall health goes down, and the risk of developing other medical conditions, commonly called comorbid conditions, increases. Bariatric surgery is normally indicated with a BMI above 35, with at least one comorbid condition, or when the BMI reaches 40, with or without a comorbid condition. Obesity not only decreases quality of life, but is also expensive and can cause up to 36% increase in medical cost for people under the age of 65. The price of bariatric surgery can be recuperated in a short 3 to 4 year period by decreasing these obesity-related medicine costs. The following weight loss procedures are the most commonly performed by our group and can be a powerful tool in reaching your weight loss goals. Gastric bypass is the most commonly performed weight loss procedure in the U.S. The procedure both restricts the amount of food that can be consumed at one time and decreases the absorption of sugars and fats. The Southwest Bariatric Surgeons perform this procedure laparoscopically 99.9% of the time, with or without robotic assistance, using just 6 small incisions. Using the laparoscopic technique reduces recovery time, causes minimal pain and scarring, and normally requires only a 1 to 2 night hospital stay after surgery. Laparoscopic technique also decreases infection rates, blood loss, and hernias after surgery. Gastric bypass results in a 60 to 80% weight loss and resolves or improves diabetes in about 80% of patients. To gain access to the abdominal cavity, 6 small incisions are created on the abdomen. Trocars, which serve as passageways for the surgical instruments, are placed into the incisions. The surgeon examines the abdominal cavity using a laparoscope or video camera. A small stomach pouch is created using a stapling device. This small stomach pouch restricts the amount of food that can be eaten before feeling full. The small intestine is separated into 2 sections. The lower portion of the small intestine is attached to the newly created stomach pouch. This allows food to pass directly into the small intestine where digestion continues. Bypassing a portion of the small intestine decreases the absorption of calories and nutrients. The upper portion of the small intestines is reconnected to the lower portion of the intestine. The bile and pancreatic fluids from the liver and pancreas allow food to be completely digested. The sleeve gastrectomy is mostly a restrictive procedure. Roughly 80% of the stomach is removed, which limits the amount of food that can be eaten at one time. With a sleeve gastrectomy, 50 to 80% of excess weight loss may be achieved within 2 years after the surgery. This procedure, which is not reversible, is a good solution to diabetes with remission or improvement in about 80% of patients and normally requires a 1-night hospital stay. Sleeve gastrectomy is a minimally invasive approach and is sometimes performed with robotic assistance. To gain access to the abdominal cavity, 6 small incisions are created on the abdomen. Trocars, which serve as passageways for the surgical instruments, are placed into the incisions. Surgical instruments are passed through the trocars to access the abdominal cavity. The surgeon examines the abdomen using a laparoscope or video camera. The average human stomach can expand to hold around 1 to 1.5 liters of food. While in the stomach, food is combined with digestive enzymes to help break down the food into a more simple form so that it can be more easily digested and absorbed once in the small bowel. During a sleeve gastrectomy, a thin, vertical sleeve is created by using a stapling device. This sleeve will typically hold between 50 to 150 milliliters, or is about the size of a banana. The excised portion of the stomach is removed. The newly created gastric sleeve is able to hold approximately 1/10 of what the stomach was able to hold before. This smaller stomach sleeve restricts the amount of food you can eat before feeling full. The bile and pancreatic fluids from the liver and pancreas mix with the food and allow it to be completely digested and absorbed in the bowel. There is no rerouting of the small bowel or post-operative adjustments necessary for the sleeve gastrectomy. Additional procedures that are offered by the highly qualified and experienced surgeons at Southwest Bariatric are gastric banding, revisional bariatric surgery, and duodenal switch. Proper nutrition is vital after any bariatric surgery for long-term success and avoiding nutritional deficiencies. These deficiencies can range from mild to severe. Special lab tests are routinely ordered for all bypass and sleeve patients to test for these. Specific guidelines for each procedure will be discussed in detail by a registered dietitian as part of the pre-surgical process. Every patient will meet with our on-staff dietitian before surgery to discuss new eating techniques, proper vitamin supplementation, diet progression after surgery, avoiding dumping syndrome, pre-operative diet, and habits that can lead to weight regain after surgery. In addition to a nutrition consult, each patient will meet with their surgeon twice before surgery, be required to have routine blood work and EKG, and have consultations with an exercise physiologist and psychologist before surgery. Other tests can be ordered depending on each patient's unique medical history. These studies assure our patients a good foundation for their upcoming major life change and help us identify any risks before surgery to make the procedure as safe as possible. All surgery presents risks and potential complications. All precautions are taken before, during, and after surgery to minimize the risks and complications from occurring. Obesity can increase the risk of these complications during surgery. There are certain risks unique to each procedure. With the help of modern technology and the vast experience of Southwest Bariatric surgeons, these risks have been minimized and are significantly less than the risks presented by remaining obese. We hope the online seminar was informative and look forward to meeting you in person where we can answer any further questions or concerns you may have. If you would like to see one of our surgeons for your first appointment, please fill out the paperwork in the Becoming a Patient tab, and one of our patient advocates will call you to set up your first appointment.